Hello, Javier. How are you doing today?
Good. How are you?
Good. My name is Zach. I'll be your nurse for today. So I understand that you're here for a full physical assessment.
Yep.
Awesome. So we will do a head to toe assessment. But before we begin, do you have any questions or concerns?
No.
No? Okay, awesome. Well, also before we begin, I'm going to perform hand hygiene. And I'm going to close the door to provide privacy. Okay? All right. And then can I see your wristband real quick? Can you tell me your name and date of birth?
Javier, 1992, January 31st.
Okay, awesome. Thank you. All right, so to begin, I'm just going to ask you some questions. Just answer yes or no. First, have you noticed any new skin lesions, any redness or any rashes that I should know about?
No.
No? Are you experiencing a headache?
No.
At all? No? Your eyes, have you had any changes in vision?
No.
Okay. Have you had any alteration in your sense of smell?
No.
Any sinus congestion?
No.
Okay. For your ears, have you noticed any changes in your hearing?
No.
Any pain in the ears?
No.
Okay. Do you have a sore throat at all?
No.
No. Do you have any pain in your neck area?
No.
No? All right. What else? Do you have any joint pain?
No.
No. Any pain when you are moving your arms or legs?
No.
No. Have you had any difficulties breathing? Okay. Do you have a cough?
No.
Okay. Have you noticed any heart palpitations or any chest pain or tightness?
None.
Have you noticed any changes in your bladder or bowel function?
No.
No? Okay. Any constipation or diarrhea?
No.
Okay. Last couple questions. Do you have any health concerns or any past diagnoses that I should be aware of?
No.
Okay. And are you currently on any medications?
None.
And do you have any allergies?
No.
Okay, awesome. Thank you. So now I'm going to perform a general survey just for your appearance. So, Javier, you seem the appropriate age. You are dressed appropriately for the weather. You are seated upright. There are no obvious signs of any acute distress. You are calm and coherent. Can you tell me what year is it currently and who is the current president?
2020, Donald Trump.
Awesome. So you are alert and oriented ×3. And are you experiencing any pain at all?
No.
You are? No? Okay, so you're not experiencing any pain and your Glasgow Coma scale is 15. All right, so now that we have done the general survey, I'm going to move on to the physical assessment. So first, I'm going to inspect the skin for any redness, any skin lesions, for your pigmentation and texture. Okay, and I'm also going to palpate with the back of my hand to assess the temperature. Thank you. All right, so the skin is pink, dry, warm, and intact with even pigmentation bilaterally. So next, I'm going to inspect and palpate the head to know for any abnormalities and to assess for any tenderness.
No.
No tenderness?
No.
All right, so the head is atraumatic and normal cephalic. And next I'm going to test your cranial nerves. So can you puff your cheeks for me? All right, smile. Raise your eyebrows. Say ah.
Ah.
And stick your tongue out. Okay, perfect. So facial features are symmetric bilaterally, and your facial features are also symmetrical bilaterally as well. So now I'm going to inspect the eyes. Okay, now I'm going to have you follow the tip of my finger without moving your head. All right, and then H. Perfect. All right, so the eyes, they were fluid and smooth upon movement. And I'm going to have you look at my finger again and just keep looking. All right, an accommodation is great. Next, I'm going to test your reactivity to light. Okay, on the outside in. Good. Okay. Outside in. Good. So as I said, your eyes are smooth when moving. Your pupils are equal. They're round. They react to light, and they're accommodated, or they have good accommodation. So everything is within normal limits there. So next, I'm going to inspect your nose. Okay. And now we're going to check the patency of your nostrils. So if you could occlude one nostril. Yep. And I'm going to have you breathe in and breathe out. Perfect. All right, now I'm going to have you do it to the other side, the other nostril. Okay, breathe in. Perfect. So the nares are clear and patent. So next I'm going to go to the ear. So I'm going to inspect and palpate. I'm looking for any skin breakdown, any redness, and also palpating for tenderness. Is there any tenderness?
No.
No? All right, so there is no tenderness bilaterally on the tragus or the auricle, and there are no obvious skin lesions, skin redness, or skin breakdown. All right, so next we're going to go down to the neck. So first I'm going to palpate your cervical lymph nodes. Okay, good. And no lymph node enlargement is noted. And next I'm going to locate and palpate your carotid artery bilaterally. Okay, now that I've done that, I'm going to auscultate the carotid artery, and as I do this, I'm going to ask you to hold your breath, and I will tell you when to breathe out. Okay, hold your breath. Okay, breathe out. Here you go. All right, now I'm going to do the same thing again to this side. So palpate the carotid artery and auscultate. Will you hold your breath? Okay. Perfect. All right, you can breathe. So your carotid arteries are 2+ bilaterally with no bruise evident. Perfect. And then I'm going to palpate your trachea, which is in the midline. So your trachea, there appears to be no deviation to either side of the trachea. So next we are going to do your upper extremities. So first I'm going to locate and palpate your brachial pulse. Okay. All right, now I'm going to move down to the radial pulse. Okay, your pulse is smooth, regular, even, and has a strength of 2+. I'm going to check your capillary refills. All right, so they refill with less than 2 seconds, so that's perfect. It's within normal limits. And next, I'm going to assess your range of motion. So if you could stand up. All right, so with your arms at your side, I'm going to have you abduct your arms up and then abduct down. All right, and then I'm going to have you put your hands out. Okay, I'm going to have you pronate. All right, supinate. All right, and with your arms right here, I'm going to have you flex and extend. Is there any pain or tenderness upon movement?
No.
Okay, and then next I'm going to assess your muscle strength. So I'm going to resist your movement. So when I push down, you push up and vice versa, okay? Does that make sense? Okay, all right, ready? Good. All right, now side to side. Awesome, perfect. You can take a seat. So you had full range of motion bilaterally, and your muscle strength is 5+, so that's great. Now we are going to move on to the lungs. Good? Okay. First, I'm going to auscultate bilaterally on the anterior aspect. First, I'm going to auscultate the apex of the lungs, which are right above the clavicle. I'm gonna have you take in deep breaths, breathe out. All right, keep doing that. All right, and now I'm gonna go down to the second intercostal space bilaterally. Perfect. All right, now I'm gonna move on to the posterior side. I'm going to find the C7 prominence and then auscultate laterally to that on both sides. So keep breathing. Okay. All right, so I just auscultated the upper lobes. All right. Yep, thank you. Okay. Okay. All right, I just assessed the middle lobe and now the lower lobes. Okay. Awesome. So the lungs are clear to auscultate both anteriorly and posteriorly. Next, I'm going to assess your heart. So first, I'm going to begin the second intercostal space on the right side and examine the aortic. Okay, I'm going to move over, still in the second intercostal space, to the pulmonic. I'm going to move down to the third intercostal space at the Erb's point. All right, fourth intercostal space, the tricuspid. And then the fifth, the mitral. Good. So the heart sounds, the heartbeat was regular and smooth, and I had a normal beat. And I was also able to clearly identify the S1 and S2. The S1 sounds, those are the closure of your atrioventricular valves, and I was able to hear them more prominently at the apex of your heart. And then I was able to hear the S2 sound clearly at the base of your lungs, since that is the closure of the semilunar valves. So overall, you have good heart rate, smooth, clear S1 and S2, and no heart murmurs are noted. Next, I'm going to move on to the abdomen. So first, I'm just going to identify each of the four quadrants. So first is the right upper, left lower, and right lower. All right, and now I'm going to auscultate each quadrant to assess for bowel sounds. Perfect. So bowel sounds were noted in each of the four quadrants, which is good. So next, I'm going to lightly and deeply palpate each of the four quadrants to assess for any tenderness. Okay, so first lightly. Okay, now deeply. All right, any tenderness?
No.
All right, so no tenderness was noted in any of the four quadrants. All right, so next, I'm going to examine the lower extremities. So first, I'm going to have your knee come up here, and I'm going to locate and palpate your popliteal artery. Good. All right, your posterior tibial. All right, and your dorsalis pedis. Perfect. And the pulse again was smooth, regular, even, with a strength of 2+. And next, I'm going to inspect the legs. Thank you. I'm going to inspect the legs for any redness, for any edema, and I'm also going to palpate to assess for any tenderness. So, okay, I'm going to palpate. Any tenderness?
No.
All right, so again, the skin is pink, warm, intact, and dry. There was no lesions, no no edema, and no tenderness upon palpation. So I didn't find any areas of concern today. Thank you for your willingness to participate and help. And I'll have you wait here for the provider. And thank you. All right.
Thank you.
And I'm going to perform hand hygiene.